all know, strategic plan is a plan at least that is supposed to be either 5 to 10 years. Initially, this plan is planned for 2020 to 2030. But now that we are in 2025, and then the NHIA National has revised their own strategic plan to 5 years. That's to say from 2025 to 2030. So in line with that national plan, that is what Kechema is doing. Now we are aligning our own plan with the national plan, making it to be a strategic plan from 2025 to 2030. That is 5 years plan. In fact, this plan helps us a lot. Is part of the policy, national policy, that each social health insurance has to do this, to set up their plan, the strategic plan of what they are going to do, to focus for 5 years at least. Now, the importance of this is that you need to know from where you came from in order to know where you are going. If you don't know where you came from, there is no way, you may likely not know where you are presently, and you may exceed where you are going unknown to you if you didn't plan well. So we are doing this plan for us to achieve a universal health coverage for 5 years.
Kechema has always been forthcoming in seeing that our programs are aligned with the programs of the National Health Insurance Authority. We began with the templates given to us by the regulatory body, and we will continue to see that all our activities are aligned with what the NHIA recommends, and even as a regulatory body has placed as the way to move forward. So it's not an accident that we have this erudite scholar to come and work out for us this very important document. Secondly, this is a time today, I think we are going to talk about costing, but I don't think it is so critical at this time when the inflation is so turbulent. It's one thing today, tomorrow is another thing. So it's not a cast on stone. The costing that we are about to do is not a cast on stone, because you cannot cost properly when the inflation is moving up and down. You will get it wrong. But it is important that the document is flexible, so that at any given time we can calculate the inflation, the influence of the inflation at the time that we need a certain activity or a certain procurement within this document.
So first of all, I think let me appreciate the progress that has been made in the agency. We have seen numerous people who cannot afford healthcare being covered under the various Kechema programs. These people are people who before were left to suffer financial hardship as a result of healthcare. This is very commendable in the NHIA. We appreciate the efforts that this agency is making, and we also want to emphasize that the resources they are using to cover these people are not enough. So there is need for scale up in covering more people who need these services. Specifically, for example, there are pregnant women, there are children under 5, there are people who are disabled, there are people who are aged, there are the elderly, for example, and those people who are extremely poor in the society. All these people need to be brought into the folds of health insurance. Well, a healthy population is a productive population. And so enrolling more people into the contributory scheme takes away that burden of paying for healthcare off their shoulder. Therefore, even the people that are employed in the first instance, they become more productive because they know that they don't need to worry if their children or their wives are sick. That's the first one. The second thing, the more people come into the fold, the more there is need for requirements like ICT, more need for data, more need for quality assurance officers, more need for people that will provide those services in the hospital. So this opens up the health insurance market for employing a lot of other human resources into the fold, so creating a lot of opportunities for job creation in the economy. With growth, the agency has grown from an agency that is barely able to cover very few people with health insurance to an agency that has covered numerous people, over 100.
Doing well in terms of digitalization, because so far all the enrollment we are currently doing in this agency is online, it's web-based automatically. We are not doing anything manually here in Kechema. However, we want to improve our digitalization from our level to the facilities, because some of the facilities now, they don't have internet access, they don't have computers, they don't have even just Android phone that they can be sending data to us due to network issues. But we are trying to see now how are we going to make that possible to work for us, so that we will be communicating with the facilities directly online, not sending the enrollee register to them monthly, because there is something we call monthly enrollee register, which comprises of the list of the beneficiaries currently accessing health services in their selected facilities. Though we are sending, before we are sending the register to them, hard copy, but now alhamdulillah we are sending the soft copy to them through WhatsApp and some email address. However, we want to have come with a model where an enrollee can do registration by himself without coming to the agency. This is what we call self-enrollment. We have a demo.
The importance of this planning, planning this can never be quantified just easily, because it will provide access to basic health care. We must to plan for us to succeed. We must to have the data of poor and the vulnerable. We must to have the data of the formal sector, of both formal and the informal sector, for us to succeed. So therefore, we must to budget properly for us to quantify the number of people that will benefit from this very, very gigantic program, because it is the most successful program ever conducted in this state.
This strategic plan is going to help us in so many ways, because whatever we are going to do, any activity that we're going to do in Kechema, it has to be according to the strategic plan. And as far as programs department is concerned, we are going to work strictly on the strategic plan. That is when it comes to marketing, sensitizing people, going for advocacy visits, we have so many programs related to that, and I'm sure it's going to take us a long way.
Implementing this strategic plan is important for you to plan on what you want to achieve. Like how some people used to say, in za a tafiya ake shiri ba sai an dawo ba. So this plan will go a long way in ensuring that indigents and residents of Kebbi State are enrolled into healthcare, into health insurance in the state. Again, it will expand coverage, like I've explained earlier. It will expand coverage and more indigents will be enrolled. Then with this plan, the facilities will have more funds for them to develop and expand. So it's a two-tier kind of thing.
I would like to assure the management of Kechema that the Kebbi State Ministry of Health will continue to support it towards the achievement of all the set out goals. We would also like to assure you of the commitment of the Kebbi State Government under the leadership of His Excellency, Comrade Dr. Nasir Idris Kaurangondo, who is continued support to this agency, ensuring that each and every person, not only indigenous of Kebbi State, each and every person living in Kebbi State has access to basic healthcare services through the KHS, the state's contributory health insurance scheme, which had earlier